Welcome to my lecture on health effects associated with mould. What I'd like to do is cover what does the research say about mould, the legislation that underpins exposure to mould in a water damaged building, how do you even know if mould is the problem, and of course how does mould impact the body. We'll then finish with a referral of if you suspect mould is a problem, who do you refer to? So what does the research say? And as I looked at the historical context, I noticed that under Leviticus in the Christian Bible that there is a reference to identifying and removing mould. And in fact, historically, if you look at death rates in humans, that a significant proportion of people have died from lung-related pathology, and in particular pneumonia, really early on in their 30s and 40s. And often this could be attributed to damp housing, straw bale, the old, cold concrete castles, and, people living in quite horrid conditions, especially in relation to housing. And I have no doubt that a significant proportion of the world's population has in fact died from dampness and mould-related pathology. What's become very clear in the last 10 years is how mould affects human health, and that's what I want to talk about in this course. So lots of media reports. Here's only 3 of many thousands of media reports that exist across the world about the exposure to dampness and health costs and litigation costs, and the growing number of people in modern housing that are impacted by dampness and mould. It's also become apparent in Australia, at least 1 in 2 Australian homes are estimated to have some degree of water damage. That's why we call them water damaged buildings. 40% of new builds in temperate climate zones like Melbourne and Tasmania have experienced condensation and mould by their first winter. I mean, that is just a shocking statistic, that nearly half of new homes, especially the 6-star energy rated homes, are showing condensation issues. And this is attributed to the fact that they are so tight that the passive ventilation is inadequate, and there are problems with water vapour because of the membranes they're using are not allowing water vapour to move through. About 85% of strata owners in multi-storey apartments that have been built since 2000 have significant defects, most of which are related to water damage from compromised waterproof membranes and leaks, etc. So that's pretty bad. And as a result of this, there have been ongoing reports in Australia about condensation in new residential buildings and what needs to be done in order to try and address this. Many reports have been written about mould, and here we go by the National Institute of Medicine, damp indoor spaces in 2004. Also the World Health Organization guidelines, I believe, was 2001. So, these documents were over 2.5 decades ago, showing that concerns about mould and in particular dampness and human health have been around for more than 25 years. And it just keeps going on and on. So it's something that we've been well aware of, and yet very little of this has been translated into clinical practice to help doctors and clinicians understand the impact of dampness on human health, and let alone the building industry. I was involved in writing a report, myself and Professor Mark Cohen, for the RACV insurance, and it was titled The Perfect Storm: The Implications of Mould in Australian Homes. And it was quite horrific, actually, because I was interviewing the top waterproof consultants and builders throughout Australia about what they think is the problem with regards to condensation and mould, and it just shows systemic failures across multiple industries. It's going to take a lot to rectify the problems. Subsequently, there was a parliamentary inquiry in 2018 called the Inquiry into Biotoxin-Related Illnesses in Australia, and a subsequent report here in 2018. And essentially they said there are systemic failures across multiple industries, especially building construction. The codes and standards are not adequate, and the way they've rectified this is to update the condensation and mould handbook by the Australian Builds Code Board, but because it's not legally enforceable, a lot of it, the existing building practices haven't changed. So until it becomes enacted in a regulation, unfortunately, I don't think we're going to see a lot of improvements in building construction. And also the other problem is many clinicians and doctors have no awareness of mould related illnesses. So many patients are being gaslit who are impacted by damp buildings and going through this medical gaslighting because they're not being heard or diagnosed adequately. Many books and standards have been written, in particular in the US, including the IICRC Institute for Inspection, Cleaning, Restoration and Certification, who've just released their 4th edition this year on the standard for mould remediation. ASHRAE, of course, are in the US as well on moisture control and design in buildings, and many other textbooks associated with it. And as I mentioned, the Australian Builds Code Board keep updating their condensation in buildings, which is a great guide actually, but because it's not legally enforceable, many of the builders are not, implementing it in their building practices. In the scientific literature, there's so much publications on mould. There's literally thousands of documents. And in particular, we refer to dampness because dampness creates mould problems, as you know. So it's important when you're looking for mould related issue, dampness is a key word when you're looking in PubMed. So just having a look here, respiratory and allergic health effects of mould, indoor mould, asthma and rhinitis, indoor microbiome and risk of infections in children, housing intervention for asthma, diagnosis of mould hypersensitivity syndrome, dampness in buildings and risk for health. It just goes on, and it's throughout many countries. I mean, there's just thousands of publications, and of course this one in 2013, which looked at the mechanism of action by which dampness could impact human health, which was 2013. I mean, this data has been here for more than 10 years, and it's, as I said, it's not being translated into clinical practice or building construction. Here are some of the most well-known dampness consensus documents, and have a look at these years: 2004, 2009, 2010, 2006, 2011, 2001. I mean, it's just been going on for 2.5 decades and yet falling on deaf ears. So as a result of that, there's actually legislation in the Australian Risk Management under the Work Health and Safety Act 2011 that requires anybody working in any home to comply. Under Part 2 Health and Safety Duties, Division 2, Section 19, there is a duty of care to maintain a work environment without risks to health and safety, and under Section 19.3G that the health of workers and the conditions at the workplace are monitored for the purpose of preventing illness. If we look specifically under the regulations, which fall, you have your Act, then you have your regs, both of which are legally enforceable. Under Division 7, Section 51B, you need to monitor for airborne contaminants. Sorry, I'm just saying that it is a requirement to monitor for airborne contaminant. I'm not saying you need to, but obviously in terms of work health and safety guidelines, it is required to be monitored, and that's where a mould testing technician or building biologist can be involved. Monitoring is necessary to determine if there is a risk to health, and under contaminant, they do define microorganisms, which is where mould would sit. So there is a requirement by restorers and remediators and insurance-related jobs and job assessors to make sure that they're assessing this. They're monitoring airborne contaminant, which can only be done with sampling. Also, under the Building Regulations 2018, in a new build, a building surveyor has the capacity to actually, determine if the building is a danger to the life, safety or health of any member of the public. And they're the only trade that have this power. Most building surveyors have no idea how to test or what a damaged building, let alone the power they have under the building regulations to actually, make that call, which is remarkable. So they do have that capacity. Under the residential tenancy regulations, so if someone is renting, there are obligations for the landlord or rental provider as well as the renter. So for the rental provider to ensure the premises is provided and maintaining good repair, including managing pest infestations and treating mould or damp caused by the building structure. The renter's responsibility are to make sure it's kept reasonably clean and free from damage, etc. So there are requirements, and this does vary depending on the state. So depending on where you are, then it will vary what the rental provider and renter's responsibilities are. New Zealand, as a result of their leaky building syndrome, which caused catastrophic impact on their building and health effects, they subsequently created an act which is legally enforceable called the Healthy Homes Guarantee Act. So it's great to see they've actually provided an act and regulations that are required to be adhered to. So, and also Britain did a very similar thing. Hopefully this will come into Australia, but don't hold your breath yet. But there are changes happening in various countries. So let's go to, is mould the problem? How do you know if mould's affecting your health? And generally, mould is suspected if clients have asthma, allergies, or chronic respiratory tract infections that are not responsive to treatment, and or long-term fatiguing syndrome that are not explained by other causes. So if they've moved into a home, their asthma's got worse, or if they've developed and it keeps persisting, that's where I start thinking, is their home water damaged? Has it got mould? Now, many people have allergies, and there are many causes of allergies like pollens and dust mite, etc. Mould is only one potential contributing factor to allergies, but what I'm looking for is the timing that it happened. Did it happen after a water event, etc.? So the symptoms would have begun when they moved into a water damaged home or started working in a water damaged building, and or following a renovation. I find many people can get sick after a bathroom reno because the builders come in, pulled off the gyprock and stripped it to frame, and there was hidden extensive mould in the walls, which was contained, but as soon as they ripped the plasterboard off and tiles, now they've cross-contaminated that room, adjacent rooms, and potentially the whole house. Wouldn't be uncommon. That's when clients can get quite sick. Or after a flood event or leak where it wasn't dried in a timely manner, and by that I mean it wasn't dried within 48 hours. You only have 48 hours after a leak, after which you will have microbial growth. Symptoms generally improve when they're away from the building. Mould is suspected in the home if there's a history of water damage like leaks, drainage issues or flood events that weren't dried in a timely manner, if there's any visible mould and or damp musty odour. By the time you see mould, you're looking at least 60 million spores per centimetre squared. So the problem with a lot of water damaged homes that we are involved with is you don't have to see the mould for it to be a problem. In fact, some of the worst homes I've seen, I could not see or smell mould in the home. It was clean, and when I've got the results back, it was really bad and they've had to move out. So that's the problem. So if you see a little bit of visible mould, it's a little problem. If you see a big bit of visible mould, more than the size of a piece of paper on a wall, that becomes more of a risk. So the amount of visible mould is important. And damp musty odour is a sign that it's growing. So that's a really important marker it needs to be addressed, that there's growth happening somewhere in the house, and more often than not it's hidden in the subfloor, under the house, in a roof, in a wall cavity, etc. So let's have a look at how mould affects health. Now, first I want to get clear, we actually don't know what it is in a water damaged building that causes health effects, because a water damaged building essentially is a chemical stew of biological agents like bacteria and fungi and all their byproducts, including endotoxins, mycotoxins, microbial VOCs. It also creates the ideal environment for other types of allergens, including house dust mite. Now, dust mite is actually the most common allergen in the world, affecting around 20% of the world's population. It's 1 in 5 people will have an allergy to dust mite, and the symptoms tend to be worse first thing in the morning, and they're all year round. Because water damage supports more allergens in the house like dust mite, but it also attracts vermin, rodents, termites, spiders, cockroaches, etc. So, and some people can have allergy responses to that. So we have this proliferation of multiple things happening in a water damaged building, let alone the degradation of building material and release of chemicals we call VOCs like formaldehyde, which in itself could be a problem. So let's have a look at how mould can impact human health. The first is a hypersensitivity, or what we call an allergic reaction. It can also affect the body through infection, especially of the lungs. It can affect the body in terms of toxin exposure, and it can cause inflammation. So let's look at type 1 hypersensitivity reactions. Now, this is Something that all doctors will be familiar with is, are you allergic to mould? And basically this is an adaptive immune response where the immune system overreacts. There are 4 types, and the one associated with mould exposure is called type 1, which involves the production of allergen-specific IgE, which is an immunoglobulin or immune cell, which binds to mast cells and causes histamine release. This is why many professional organisers have to take antihistamines, because they're producing histamines, which causes redness, irritation, mucus, sinusitis, hay fever, coughing, irritation of the mucous membranes when they're dealing with mould contaminated contents. So the antihistamines help. But this is what's going on. It's a type 1 hypersensitivity or a true allergic reaction, which generally happens within 30 minutes from the time of exposure. And it causes asthma, irritation, red, itchy eyes, rhinitis, which is inflammation of the nose, so congestion or mucus production. It can even cause skin problems like eczema or itching and redness of the skin. So this is what we call a true allergic reaction, and we know a significant proportion of asthmatics will have a true allergic reaction to mould. In the worst case scenario, it can cause anaphylaxis, which is death. So just to have a look at the mechanism involved, you've got an allergen. It acts on a B cell, which is an immune cell that produces IgE, which attaches to mast cells, which then degranulate to cause histamine release. On second exposure, these mast cells, as soon as they expose to these allergens or antigens, which are proteins on the cell wall of the mould, it results in this degranulation of mast cells, which causes all those horrible symptoms that people get when they have allergies. Now we know the mould that can cause these type of allergies are Aspergillus, Chaetomium, Cladosporium, Alternarium, Penicillium, and in particular the different species of these molds. So Aspergillus is the genus, and the species could be Fumigatus, Alternata, Flavus, or Niger. So diagnosis is generally through a blood RAS test or a skin prick test. So if you suspect your client is sensitive to mould and they're getting symptoms all year round because they're living in these water damaged buildings, then definitely refer them on to a doctor, who will then refer them on to a respiratory specialist to get a blood test or skin prick test to confirm it's a mould allergy. Lots of data on mould and asthma, and I've just given you the first author and year, and all these references can be found at the end of this presentation. The second way mould can impact human health is through a respiratory tract infection. So you'll find if you're living in water damaged buildings, many people will end up with recurrent colds and flus that keep coming back and are not responsive to treatment. The infections go on for weeks or months, and regardless of antibiotics or herbs or bioceuticals, they keep persisting. So they come and they keep coming back. So that's really common, and generally some people will react earlier than others, but eventually most of us will have ongoing respiratory tract infections affecting the upper and the lower respiratory tract infections. Most of the exposure happens through inhalation of fungal particulate. And infants' exposure, however, often happens from ingesting household dust, where most of that fungal spores and particulate is. So that's really important to be mindful that infants will be at high risk because they're ingesting these household dust. So the main infections we see are recurrent upper respiratory tract infections like your itises, sinusitis, inflammation. Itis is inflammation of the sinus, tonsillitis, inflammation of the tonsils, pharyngitis, inflammation of the throat, laryngitis, inflammation of the larynx, and of course hay fever. But also recurrent lower respiratory tract infections like bronchitis, recurrent colds and flus, pneumonia. I see a lot of patients with pneumonia as a result of being in water damaged buildings. Now the nature of the infections is that they're recurrent, they keep coming back and they're persistent, going on for weeks or months. They often begin after moving into a water damaged building or after a water event or renovation, and they don't often respond to treatment, they just keep coming back. Often they'll improve away from the home. So here are some references on the respiratory tract infections. As I mentioned, all of these references are listed in the resources at the bottom of this presentation. The third way that mold can impact the body is through toxins, and basically fungi will secrete secondary metabolites called mycotoxins and microbial volatile organic compounds. That's a mouthful, isn't it? MVOCs are actually fungi farts, so they're the gases released from microbes in the process of growing in the presence of moisture. So that's the damp, musty odour that you smell, is MVOCs. Mycotoxins is the one that can cause serious adverse health effects. And we know several fungal metabolites have been used in drugs such as antibiotics and statins. So actually, many mycotoxins are used in medicine because they're so powerful. And many of these mycotoxins are considered to be the most deadliest known chemicals known to man. So, penicillium or penicillin is actually derivative from Penicillium mold, and statins, which is the most commonly used drug in the world for cholesterol-lowering drugs, were actually developed from fungal metabolites. So these are powerful things. So with mycotoxins, there's a very long history of mycotoxins in livestock feed and massive livestock deaths, like many animals, cows, horses, sheep, have died as a result of eating and ingesting contaminated grains and livestock feed. That's really well known in the literature. Mycotoxins, as I mentioned, are primarily found in grains and livestock feed, and this is why many patients with mold illness have to stop grains, and in particular gluten. You will find mycotoxins are very common in coffee, wheat, rice, oats, barley, very, very common. So as I mentioned, it's important that clients who have severe mold illness need to stop grains, and in particular gluten, for that very reason. Mycotoxins can also be found in household dust bound to particulate matter. However, most of the adverse health effects associated with mycotoxins actually come through ingesting grains. And this is because your grains are stored in silos that get wet, and that supports the growth of mold and mycotoxins on these grains. Now, most people can deal with that because they've got stomach acid and other mechanisms to deal with it, but people who are very sensitive to mold, as I mentioned, grains is going to be a big problem. Fungi and water damage building that produce mycotoxins are Aspergillus, Penicillium, Stachybotrys and Fusarium, and examples of mycotoxins are aflatoxins, ochratoxin, etc., trichothecenes. As I said, these are some of the most deadliest known chemicals known to man. Just to give you an idea of how toxic they can be, ochratoxin, aflatoxin is carcinogenic. We know it causes cancer. It's hepatotoxic, so it can cause liver disorders. Immunotoxins mean it can affect the immune system. Nephrotoxic means it's toxic to the kidneys. Neurotoxic means it affects the central nervous system. Estrogenic means it can mimic the effect of estrogen, and teratogenic essentially means it can cause birth defects in utero, so pretty serious adverse health effects. Now, some clients will do mycotoxin testing of their urine to identify these mycotoxins. Look, in terms of clinicians who are aware of mold illness, a lot of them are moving away from mycotoxin testing because a lot of these can be found in grains through the diet. So it can be a bit challenging to determine, is this coming from the person's diet or is it coming from their home? For a building biologist or mold testing technician, we'd have to do viable sampling, which means we have to do sampling that we send to the lab where they're growing it on agar, which is expensive. You're looking at $200 a sample to determine what colonies are there in order to match, is that species of Aspergillus actually causing aflatoxin, to map it to the client's urine. It's expensive to do that. And as I said, a lot of the experienced clinicians in mold treatment are moving away from this type of test, but it's not uncommon for people to do it. I mentioned microbial VOCs, which are fungi farts. So basically that's the damp, musty odour, and it's a really important mark. If you're going into client's home and you can smell a damp odour, it means that there's microbial growth both of bacteria and fungi. And as you can see here, these are different chemical makeups. Ketones, alcohols, esters, carboxylic acid, terpenes that are created from these chemicals. Like, they've actually broken them down into different chemical structures which have Cas numbers in order to identify what those chemicals are. We don't generally test for chemicals or MBOCs in the environment because it's transient and it depends on many factors such as temperature, light, pH, how old the mould is, whether it's growing or not, and what substrates it's growing on. But the fact that the client can smell damp, musty odour is already an immediate risk that you could be exposed to mould in the environment. So it's an important question to ask. The other way that mould can cause problems is through inflammation. Now, Richie Shoemaker's work identified that about 1 in 4 people globally are likely to have a unique genetic predisposition where their immune system cannot create antibodies to the proteins or antigens on the mould. And what happens in these people is, instead of getting these respiratory problems, they end up with these chronic fatigue-like symptoms due to low-grade inflammation. And often these symptoms can reflect autoimmune disorders. So fatigue, long-term fatigue that's not alleviated by rest, brain fog, poor concentration, poor short-term memory, missing words mid-sentence. It's like a pre-Alzheimer's brain, but when they get an MRI, there's nothing they can find on the scan. They often have sleep disturbances, so difficulty sleeping at night. They often sleep during the day. Their whole circadian rhythms are out of whack. Fibromyalgic, so muscle weakness and fatigue, and increased sensitivity to chemicals, noise and light, and heightened smell. So these are pretty typical symptoms for clients with these long-term fatiguing syndrome. Now, patients can often be misdiagnosed with building-related illness, sick building syndrome, chronic fatigue syndrome, autoimmune disorders. I've seen quite a few women with multiple sclerosis. When you take a history, it's actually occurred when they've moved into a water damaged building or after a flood event. Now, I'm not saying everyone with MS is due to mould, but I think it's interesting that, I've had a handful of women who have been diagnosed with MS in these water damaged buildings that correlated with the timing of their exposure with their symptoms when they moved. The more accurate diagnosis for these chronic fatiguing syndrome is either chronic inflammatory response syndrome, or CIRS, or dampness and mould hypersensitivity syndrome. Now, the diagnosis of chronic inflammatory response involves having at least 8 of the following symptom clusters according to Richie Shoemaker's diagnostic panel. And obviously fatigue is very common, and brain fog is very, very common. In fact, it's difficult. You'll find that this will be the 2 most common symptoms they'll experience. And you can see it's pretty horrific when you read this. I mean, a lot of these people, there's different degrees, but can be so incapacitated they can't work, they can't get out of bed in the worst case scenario. So, it can be very, very debilitating. And what's worse is some of them can be medically gaslit by the medical industry, where they're saying it's all in your head, it's a psychological problem, when in fact, when you take a history, you can see that it's happening in these water damaged buildings. So just to give you an idea of the pathology involved, I don't expect you to know this, but just to show you what we now know is people may have a genetic susceptibility, or as a result of susceptibility may also be increased with young children. Don't forget, it takes till about 20 years before your lungs are fully developed, and when you've got young children crawling all over a floor, which could be loaded with fungal particulate, then they're at much higher risk. It can be due to atopy. So clients who have a history of asthma or allergies or food allergies as children are going to be more at risk for water damage related symptoms. If there's been significant trauma in their life, emotional and or physical trauma, that can also increase the susceptibility to these chronic inflammatory response syndrome. So essentially, they in these water damaged buildings or workplaces or even cars. I've seen people have water damaged cars that are causing these symptoms. and that eventually activates the innate immune response, which increases the biomarkers for complement C4a, TGF-beta, MMP9, matrix metalloproteinases 9, which then activates the adaptive immune response. And because it cannot clear these antigens or mold, it ends up causing these hormonal balance and gene dysregulations that cause multi-symptom illness affecting multiple organs in the body, including their lungs, the musculoskeletal system, often their hormonal system, the neurological system, etc. But there are markers that these doctors who are familiar with mold illness will look for, including MSH, melanocyte stimulating hormone, vasoactive intestinal polypeptide, antidiuretic hormone, and ACTH. So there is quite a useful pathway or impact on the pathology. I love this pathway, and of course you go, oh my God, this is so overwhelming, but it actually provides a good understanding of what happens to these clients who get these long-term fatiguing syndrome. In a healthy person, the body recognizes the proteins on the cell wall of fungi and then removes it from the body via the blood, the liver, and eventually through the bowels. So it's removed. But people with these genetic susceptibilities, what's happening, the biotoxin is impacting onto a cell of the body, toll-like receptor, which acts on the hypothalamus in the brain or leptin receptors that then impact melanocyte stimulating hormone. Now, MSH is such an incredible neuropeptide because melanocyte, as you can hear, melanin or melatonin affects sleep. It affects endorphins, so they get chronic pain throughout the body. It also affects the gut, so they end up with these leaky gut syndromes. I've seen clients in water damaged buildings that end up with food problems that aren't related to their diet. So that's what's remarkable about these exposures. But it also means they end up having a lot of infections throughout the body, including the upper sinuses area, then the vaginal flora and the bowel, because MSH is really important at regulating infections in the body. And of course, this cytokine response results in significant cognitive decline, poor concentration, poor memory, etc. And so if you have a look at this and see the different stages, eventually over long term their hormones get impacted quite significantly, which can result in lots of downstream effects. Another diagnosis similar to SIRS that they're using in the literature is dampness and mold hypersensitivity syndrome. So this is quite an interesting article you can read. And the other one that's becoming apparent is many of the clients show hypo or low thyroid related symptoms. So, gaining weight and, fatigue, poor concentration, poor memory, all the symptoms I indicated actually are very similar to hypothyroid symptoms. But when they're going to the doctor, because often they'll go and the doctor thinks, okay, it's your thyroid, let's check your thyroid stimulating hormone and your blood levels of T4 and T3 hormones, and it's normal. Unfortunately, what's happening is the doctor needs to check for abnormal FT3, blood levels of the hormone for T3, and reverse T3 ratio. And what they'll find is there's high levels of reverse T3, and that's the clincher that it could be more likely to be due to a mold-related problem. So this article is very helpful if you suspect clients have thyroid problems and they're not getting anywhere clinically, then this document might be helpful to pass on to their clinician. So who to refer to if you suspect that you or your client is impacted by mold? Well, there's some great integrative clinicians through ACNIM, which is the Australian Clinical Nutrition and Environmental Medicine. There's also a group of doctors called ACIDS, which is the Australian Chronic Infectious Disease Society. They are really great organisations, and if you go to those websites, you should be able to find doctors that specialise in mold-related illness. A lot of naturopaths are getting on board now and much more aware of mould-related pathology, so you can get that through their association, Australian Traditional Medical Society. If you need the client to get the house tested, then going through the Australasian Society building biologist to find a mould testing technician or building biologist there. And of course, if they need to remediate the house, you would go to the IICRC for mould remediators. Thank you for that. I hope I haven't overwhelmed you, but I really wanted to give you a very good understanding of where we're at with our understanding of mould, that this is a serious issue. It's often going under the radar, and many clients can have dramatic impacts on their health, their relationships, their capacity to work as a result of exposure to mould. So I think it's important for you to be aware of it, because you may be the very first person to link, potentially mould related issues with their adverse health effects, and that can have a dramatic impact on their health.